Hi everyone, good afternoon and welcome to our webinar on understanding the revised Ambient Air Quality Directive and what our future government must do to protect our health and our environment. My name is Clodagh Daly and I manage Community Law and Mediation Centre for Environmental Justice. I'm really delighted to be joined today by Emma Budd and Dr. Cale Lawlor, who have generously offered their expert legal and scientific insights for today's session. But before I hand over to Emma and Cale, I'm just going to provide a brief introduction to community law mediation and our work on air quality for those of you who are new to us. So community law and mediation was set up in 1975 as part of the campaign for civil legal aid. Our offices are based in Coolock in North Dublin and in Limerick, but we offer our services nationwide. So our primary service is our free legal advice clinics, which are offered across areas like housing, employment, social welfare, equality, children's law. And then in 2021, we established Ireland's first Centre for Environmental Justice. Air quality is an issue that has presented to our free legal advice clinics in rural as well as urban areas. We're very alert as well to the unequal distributional impacts of air pollution. We know that certain groups are more exposed to air pollution than others because of where they live, where they can afford to live, and the level and quality of healthcare that they have access to, or because of existing respiratory issues. The United Nations Special Rapporteur on Human Rights and the Environment in his 2019 report on clean air and human rights found that poor air quality has implications for a very wide range of human rights, including the right to life, health, water, food, housing, and an adequate standard of living. And that report further found that states have both procedural and substantive obligations in relation to the right to breathe clean air. So in Ireland, solid fuel burning is a primary source of particulate matter, but we also know that some 29% of the Irish population are estimated to experience energy poverty, the highest recorded rate. And while many households burn solid fuels as a secondary source of heating where it is not required, we also know that about 16% of the population do rely on burning solid fuels to heat their homes as their primary heating source. So energy poverty and air pollution are very closely connected. And in our experience and through what we've seen in our clinics, those living in energy poverty or at risk of falling into energy poverty are more likely to burn solid fuels or even toxic waste due to a lack of readily available and affordable energy alternatives. So it's essential in our view that in working towards protecting the right to clean air, that energy poverty is also addressed. We know that Ireland's national retrofit programme is not yet adequately targeted to communities, particularly vulnerable to energy poverty, and that includes members of the traveller community, low-income households, and then tenants in the private rental sector as well. It's also essential that Ireland develops a specific measurable reduction target to address energy poverty alongside energy poverty legislation similar to the Fuel Poverty Act in Scotland, because that would actually work towards ensuring long-term political commitment towards the eradication of energy poverty. But I'm now delighted to hand over to our expert speakers. So Emma is going to take the lead. So Emma is an English qualified solicitor who has worked in Paris, Geneva, and Brussels, and she's now based in the London office of the environmental NGO ClientEarth. Here, Emma leads strategic litigation in Western Europe on the right to clean air and advocacy on the revision of the Ambient Air Quality Directive at the EU level. So following the passing of the revised directive, Emma's work now focuses on its implementation across the EU and in particular on the role of cities, multi-level governance and transport systems. So thank you very much for joining us today, Emma.
Thank you so much, and thank you for that kind introduction. Just before we start, apologies to everyone. It's a very sunny day in London today, so you might get either only my chin and lots of it, or not very much of the rest of my face. So apologies for that. I am just going to start by sharing my screen. Hopefully this works. Super. Is that all right, Clodagh? Fantastic. So yes, thank you so much for that. As you said, I've been working on the revision of the Ambient Air Quality Directive, ClientEarth's advocacy around that in Brussels until very recently on behalf of ClientEarth. Just very quickly, for those of you who maybe haven't come across ClientEarth before, we're an environmental NGO which uses the power of the law to effect positive change on the environment in a way that protects people and planet. So today I'm going to talk to you about the Ambient Air Quality Directive itself. I'm hoping to talk you through some of the kind of main provisions, the most important from our perspective, and try and demystify some of these a little bit, because I know they can seem quite complicated and burdensome, but I would argue they actually present opportunities, particularly for local authorities going forward. So just a word quickly on why a revision of the Ambient Air Quality Directive was necessary. Great. So the existing Ambient Air Quality Directive 2008-50 came into force in 2008, and it put in place the current legal framework for air quality regulation. And one feature of this are the limit values, which are legally binding limits on permitted pollutants in the air, which should be attained by a certain deadline and then not be exceeded again once attained. And these drew on the air quality guidelines of the World Health Organization, which were published in 2005. So they were not completely the same as the World Health Organization guidelines, but these 2005 guidelines had been consulted or considered when coming up with the limit values in 2008. Since then, however, as Cale will talk about a little bit more later, the science has really developed and evolved quite quickly with various studies, of which that 2013 one is just an example. But that evolution of the scientific knowledge ultimately culminated in an update of the World Health Organization guidelines in 2021. Which represented the kind of state of the art on the scientific knowledge of the health effects of air pollution, and dramatically revised downwards the kind of maximum limits of air pollution which were considered acceptable to human health. And yeah, Cale will talk a little bit more about that shortly. But meanwhile, the European Commission, or the European lawmaking machinery, was moving more slowly. So we see on the left-hand side that there was an increasing recognition that there may be a need to assess or revise the European standards, but this just moved a lot more slowly. So there was a review that actually isn't included here, but a review into the limit values for PM 2.5 in 2013, which kept them at the same level. And then various other European initiatives, which ultimately culminated in the decision to revise the Ambient Air Quality Directive, for which a proposal then came out in October 2022. The reason that this discrepancy was a problem was that from 2021, when we kind of had that state-of-the-art knowledge on the latest, or kind of the latest knowledge on the scientific maximum levels of air pollution which were permitted for human health. I don't talk about maximum safe levels of pollution because, of course, there is no safe level of pollution, which is why I'm using a slightly convoluted phrase. But between that date in 2021 and the update of the legal framework, we were living in a situation where the air quality to which European citizens were exposed could be considered lawful, so within the bounds of the law, but not safe. So that's demonstrated by these two graphs that you can see here, hopefully reasonably clearly. I've highlighted some Western European states as an example. So Ireland is the top one in each case. And we have Italy, Belgium, and Germany. Here on the left, we have the concentrations for PM 2.5, and on the right for nitrogen dioxide. And what you can see is that the air quality sits between this bright red line, which represents the European standards, and this dotted red line, which are the World Health Organization guidelines. And what that means is that in falling below this red line, the air quality could be considered safe, or sorry, could be considered lawful, legal, and therefore not requiring any redress legally, but was not safe because it was, after all, still above what the science said was the maximum acceptable. And so we were in this sort of limbo of discrepancy between the science and the law. Happily, as I say, the European Commission has decided to review the Ambient Air Quality Directive, which followed with lots of lovely twists and turns, these kind of big steps. culminating in, very excitingly, today, the publication of the Ambient Air Quality Directive in the official journal of the European Union, which means that it will now enter into force in 20 days' time. So from the initial proposal in 2022, through the negotiations and votes, finally we will have a new directive next month, which is very exciting. Then there will be 2 years, of course, to do the transposition before it really becomes enforceable. A few headline points on things that have changed in the new directive. I won't go into too much detail on the updated air quality standards because I think Cale will talk a little bit more about that. But essentially, they have been strengthened compared to the previous directive, but unfortunately still failed to align with the World Health Organization guidelines. So air quality will remain lawful but not safe for a while longer, but at least that gap has been significantly narrowed. And I think that's a particularly impressive feat in the kind of current political climate, which has seen in Brussels a bit of a backlash against environmental laws. And I think that highlights the importance that is at least placed on health and on legislation, which while protecting the environment also does protect health. And I think we really see how important that continues to be to lawmakers. Getting into the real nitty-gritty now, and please excuse me if I'm speaking too fast, and or stop me if I start running too long. But 2 aspects that are really exciting for us as a legal NGO are new procedural rights, access to justice and compensation. And I thought it was worthwhile just dwelling on these very quickly because there's some confusion, I think, about what these really mean. Starting on the left-hand side with access to justice. This, in fact, derives from the Aarhus Convention, which is a piece of international law, which has 38 signatories, of which the EU every EU member state is one, and also the European Union itself. So, in fact, these rights already exist within the European Union, and they are rights relating to access to information, public participation in decision-making, and access to justice in environmental matters. However, despite the fact that these rights were already in force in the European Union, they were applied very kind of patchily. For example, the European Commission actually brought an infringement proceeding against Poland and another against Bulgaria for not implementing them correctly. So while these rights have existed for a while in the EU, they just haven't been applied evenly throughout the EU. So the intention, including them in the Ambient Air Quality Directive, is just to create a level playing field, really, and make sure that each member state is following the same rules in the same way. So it's really just to create clarity. And what this right entitles citizens and civil society to do is go to courts to challenge the substantive or procedural legality of any decisions, act, or omissions relating to basically the citing of sampling points or the establishment of air quality plans and roadmaps. So it entitles the public concerned, which are defined as either individuals affected or likely to be affected by or having an interest in the decision-making procedures related to these rights, to these sampling points and air quality plans and roadmaps, or NGOs which promote the protection of public health or the environment. And as I say, it gives those actors the right to go to court to ask the court to assess or to challenge the substantive or procedural legality of the decisions, acts, or omissions, and the remedy there will be effective and adequate and may include injunctive relief. So it's really about giving citizens the right to ensure that environmental law is being respected. Meanwhile, the compensation right is more personal. So it's given to natural persons, so not the public concerned, but natural persons who suffer health damage caused, so as a result of a violation of national rules relating to air quality. So these articles relate to air quality plans and short-term action plans, which have been committed intentionally or negligently. So I've heard a lot of kind of anxiety around kind of hordes of members of the public coming forward and saying, well, we've been exposed to illegal air quality and we've got asthma, so please can we claim some money? I think that's extremely unlikely to happen on the basis of this, just because that's not sufficient to claim compensation. In order to claim compensation, not only do you need to prove that you're unwell, and you need to prove that that illness is caused by a violation of the rules on air quality plans and roadmaps specifically, and that that violation has been committed intentionally or negligently. This is a very high procedural barrier, I think. Already the question of whether a health issue has been caused by air pollution is something that papers and papers have been written on. Cause means something different to lawyers than it does to epidemiologists and doctors. So that in itself was a subject of much debate during the negotiations. But then the fact that it might have been caused by air quality plans which have been intentionally or negligently not done correctly is, I anticipate, being very, very hard to prove. So I don't think there needs to be any concern about this being applied widely, I think. But it is important because it demonstrates an increasing recognition by lawmakers, again, of the tangible health impact, the tangible impact on citizens and their lives of pollution. And I think that's a really important indication of the direction of travel for environmental law. So from that perspective, this is a really exciting addition, even if in practice, I'm not sure there'll be huge, I'm not sure there'll be many cases. Although, nothing precludes member states from adopting a more open approach to this, but this is kind of the baseline. I was also going to go into new rules on air quality plans and roadmaps. Do I have time, Clodagh, or should I take? Yeah, okay, perfect.
Please do. Yeah, thanks, Emma. That's great.
Fantastic. So another feature that is new about the directive, or that is built upon about the directive, is a clarification or an increase in the rules on air quality plans. And again, there's not that there's so much new here, but there's a real clarification of existing rules. So previously we had frameworks, but not as much detail on what needs to be included, which I think might have led to some confusion by public authorities. So, for example, here, when we talk about air quality roadmaps, these are air quality plans as we knew them before, but which have to be established before the deadline for compliance with the limit values. So under the existing directive, so 2008-50, you might remember air quality plans as those things you have to establish if you are breaching the limit values after the deadline, or if you in advance of the deadline, I think if you were breaching a certain margin of discretion, but very few rules were provided, if any, on what plans before the deadline came into force had to contain. So what these new air quality roadmaps are is just those plans renamed with a bit more kind of meat on them. And so looking in detail at what the rules are, essentially, if between January 2026 and December 2029, you are already breaching or you're already in excess of the limit or target values which are due to come into force in 2030, there's an obligation to establish an air quality roadmap demonstrating what measures have been put in place which will ensure the attainment of the respective limit or target value by the expiration of the attainment deadline. And these roadmaps need to be established no later than 2 years after the calendar year during which the exceedance was recorded. So say on the 1st of January 2026, you look at your measuring stations and they show an exceedance of the limit values which are going to come into force in 2030. There's an obligation now to put in place an air quality roadmap by, at the latest, the end of 2028, if that exceedance is recording in January 2026 already. There is an exception to this, but it involves having to demonstrate various things and sending a detailed justification to the Commission. So the exception is there, but you would just need to send a detailed justification. But the purpose of this is to help, basically, help achieve compliance in time. So rather than kind of getting to the compliance deadline and not being in compliance with the limit values and then kind of panicking and having to establish an air quality plan and also facing enforcement proceedings, this is designed to help planning early in advance so that compliance can then be achieved. And the reason that I think this presents an opportunity for local authorities is that it also hopefully gives those authorities a chance to request any additional resources they might need in order to achieve compliance on time. So say you get to 2026, you go, I'm going to have to put in place all of these measures, but I don't have the funding for it, or I don't have the competences in the kind of legal right to put in place these measures. It creates time to go back to central government or to other levels of governance to say, hey, in order to achieve compliance in 4 years as we're required and avoid facing costly enforcement proceedings, please can we have some more resources now? So I think this could be a really valuable opportunity to kind of see in advance what sort of resources will be necessary in order to achieve compliance on time. Air quality plans, what is now called an air quality plan, is the kind of air quality plans that we knew about from the old directive, which are those that need to be established after the compliance deadline if compliance with the limit or target values has not been achieved. So as you may remember from the previous directive, these plans need to be established if the levels of pollutants are exceeding the relevant limit or target values, and they need to insert or contain appropriate measures to achieve the limit or target value concerned and to keep the exceedance period as short as possible. So far, so similar. What's different here is that there's a stopgap to this. So in any case, no longer than 4 years from the end of the calendar year in which the first exceedance was recorded. So there's a kind of deadline. Within 4 years, the exceedance needs to be over. And this plan needs to have been established no later than 2 years after the calendar year when the exceedance was recorded. So in plain English, if you've got an exceedance in 2030, it's the 1st of January 2030, the new limit values have just come into force and you're still exceeding the limit or target value, you have until the end of 2032 to put in place an air quality plan, which contains appropriate measures to ensure that the exceedance period has finished by the end of 2034. If by 2035, which is what is meant here by the 3rd calendar year after the deadline for establishment of the air quality plan or roadmap, so 3 years after the deadline for putting in place the map, which in itself was 2 years after the deadline for achieving compliance. So if by 2035 an exceedance is ongoing, then there's an obligation to update the air quality plan or roadmap, including the measures and projections therein, and ensure that compliance is achieved by the end of that year, essentially. It's not very clearly phrased, but just to run through it again, the limit values need to be achieved by 2030. If on the 1st of January 2030 you're not achieving compliance with the limit or target values, you have until the end of 2032 to put in place a plan in order to achieve compliance by the end of 2034. If you're not achieving compliance by the end of 2034, you update your air quality plan over the course of that year in order to ensure that compliance is achieved by the end of that year, so by the end of 2035. In terms of what actually goes into those plans and roadmaps, and there are all sorts of kind of allowances for if you've got a roadmap in place, how do you integrate that roadmap with the plan that you have to make, of course, to avoid administrative burden. So you integrate the plan and the roadmap so that can form one big thing. You don't constantly need to be doing new plans unless they're demonstrated to be ineffective, in which case you just update it. In terms of what the content of the plans and roadmaps themselves should be, this reference to Annex 8 is quite similar to what was in Annex 15 under the previous directive. So these 2 points, A and B, you'll see quite a lot of similarity to what the rules already were. Point C, which refers to point B of point 2 of Annex 8, we'll look at in a second, and refers to relevant pollution abatement measures, and we'll talk about that in a moment. And then there are some more rules on including, where appropriate, measures aimed at the protection of sensitive population groups. If you have a roadmap which needs to be, and plan which needs to be put in place in respect of several pollutants, you can integrate this. Consistency should be aimed for with other environmental plans, that kind of thing. This information on relevant pollution abatement measures refers to this new part of Annex 8. And what this essentially is a list of indicative measures which should be considered as part of the air quality plan or roadmap. So they're not mandatory measures. As you can see, there's quite a lot of detail, there's quite a lot of options. It's not that there's an obligation to put in place these measures, but there's an obligation to consider these measures and inform and put information on which measures have been considered for implementation into the plan or roadmap. And it's hopefully quite a useful list in seeing the sort of measures which might be helpful in the context of reducing air pollution. And again, if you see a measure and you're like, oh, actually, I'd love to do that, but I don't have the funding or I don't have the power. It's an opportunity to go up to central government and say, hey, we have an obligation to put in place some measures. Here's an example of a measure the European Union thinks is a good one, but I don't have the money or power to do this. Could you please unblock some of that financing so that I can comply in order to then achieve compliance by the deadline? Then, yeah, it'll be interesting to see if you have a plan which said we considered this measure, but unfortunately central government didn't give us the funding. I think that would be an interesting dynamic that we haven't seen before, I think. So it's just a really quite interesting list of measures which the European lawmakers think will be are good potential options as a suggestion for how to reduce air pollution, which have to be, not all of these have to be considered, of course. They're just suggestions, they're not mandatory. Coming to the final issue, I'll talk about it only very, very quickly because I'm conscious of time, but essentially something that's been talked about a lot in the civil society community is a kind of extended option to postpone compliance with the deadline. So the deadline for complying with the limit and target values is 2030. Under the previous directive, so 2008-50, there was the option of applying for a postponement under certain circumstances for up to 5 years. In the new directive, this option has been unfortunately extended in certain circumstances to up to 10 years. And there's been some excitement about that in certain quarters. But there's a couple of things to bear in mind. One, in order to achieve this isn't a blanket kind of ability to apply for a 10-year postponement. In any case, when applying for a postponement, a justification needs to be provided for the postponement in the first place and for the number of years requested. And the Commission will grant the postponement for the number of years which it deems appropriate. So it won't necessarily be 10 years. It'll be decided on a case-by-case basis. And then in order to obtain the postponement, as I say, one will have to comply with certain conditions, and then throughout the postponement period, we'll also have to continue to comply with certain conditions. And these are mainly linked to rules relating to plans and roadmaps. So coming back again to the rules on plans and roadmaps, although I think they can seem quite daunting, they are a very useful tool, I think, particularly so in this new directive, both because the rules have been fleshed out with the intention being to provide greater clarity and therefore greater equality across the European Union, across different member states, rather than see it kind of patchily applied. But also in order to give local authorities the tools they need to see what needs to be done in order to comply with the deadline, or to ask for a postponement where necessary, and then to achieve compliance by the deadline. So yeah, I can see the new rules being daunting, but hopefully they do prove to be a kind of positive step forward, which help public authorities to get the resources and the information they need. I will stop there. Great, and ask if anyone has any questions.
Thanks so much, Emma. That was a very comprehensive and useful overview of the directive and why and how it's been updated. That was excellent. And just to also encourage anyone in the audience who has a question, please do ask it. You can type it in the chat box or in the Q&A box, and we'll get to it. I'm going to hand over now, though, to our second speaker, Dr. Cale Lawlor. So Cale is a doctor and environmental public health consultant, currently based in Gothenburg in Sweden, but formerly of Dublin. Cale initially trained as a medical doctor in Australia, and then following this with training in public health, he worked in Dublin as a public health doctor, mainly with infectious disease and environmental health. And he's worked in EU public health and environmental policy across a number of countries internationally, including Georgia, Nepal, and Tajikistan, and currently works for an air pollution and climate change NGO in Sweden called Air Clim, as well as consulting on climate change and health for the World Health Organization. So thank you for joining us, Cale. We're very lucky to have you as well. And I have just made you co-host in case you have slides that you would like to share. That should work.
Perfect. Thank you. Thank you for the very nice introduction. And I will just share my slides now. So let me know, please, when you can see them. Can people see my, yep, okay, great.
Great, thank you.
Okay, so great. Thank you everyone. And thank you, Emma, for that excellent presentation before about exactly how this will all be done. And hopefully I'll be able to add some context as to why I think, and why many of us hopefully think that this is a really important issue and a really important topic. So I'm going to be talking about the health side of air pollution and why it's such a significant issue, and kind of getting down to if the air pollution, Ambient Air Quality Directive does enough for public health. And I think Emma kind of touched on it there, and I'm of very similar opinion. So maybe you already know the end of this story, but we'll get there together. So firstly, just some very busy slides on what air pollution is all about and where it comes from. So there's a few different types of there's many different types of air pollution and pollutants. The main ones that we usually talk about in health circles and in things such as the Ambient Air Quality Directive are particulate matter, named PM, PM10, PM2.5, and sometimes PM0.1 or ultrafine particles. Nitrogen oxides such as NO2, sulfur dioxide, and ozone. So those are some of the main headline air pollutants. There are others, and there's quite a lot of other ones mentioned in the Ambient Air Quality Directive, but a lot of these have similar sources. So you normally get these released when you have combustion, incomplete combustion of any sort of biomass or fossil fuel, which includes transport, so internal combustion engines, but also in power generation, industry, and volcanoes, for example, for sulfur dioxide. But you also get this from, say, ammonia, which is used in agriculture and in food, like animal husbandry. So from manure and runoff from animals, but also lots of other natural processes. And also a lot of these pollutants will go on to have secondary reactions in the atmosphere and transform into another type of pollution. So for example, ammonia pollution from agriculture and from nitrogen fertilizers is a major contributor in Europe to PM2.5, to particulate matter, up to 50%. So, ammonia is an air pollutant in of itself, but it can also undergo secondary transformation into another air pollutant. Particulate matter is particularly nasty. Same with ozone. Ozone is a secondary formation, a secondary gas formed by the chemical reaction between different pollutants, especially in the presence of sunlight. So it's a major issue in summer, for example. Without getting into too much of the chemistry and atmospheric physics of it, there's an overview of the different types and how they can interact. And just here on the right is a fairly famous picture from a study from a few years ago that gives an idea as to why these things are named this way and how the size of them. So you've got PM2.5 there in the red, which is a fraction of a human hair, and that leads to why it's such an important issue, because particulate matter, particularly PM2.5 and smaller, and the gases can easily be breathed in, and then they cross the barriers in between the air and your blood, and sometimes blood and your brain. But we'll get on to that and to how those effects are particularly potent. But in terms of the main studies in epidemiology and air pollution, basically air pollution can have an effect on every organ in your body. There's lots of different studies out there that show, a little bit of an effect here, a little bit of an effect there, but the main headline health effects are particulate matter is linked to cardiovascular disease, including heart attack and stroke. It's also related to respiratory disease, including chronic obstructive pulmonary disease, so the kind of lung damage you get from long-term smoking. It's related to lung cancer, but also many others. And particulate matter is increasingly being linked to diseases and conditions basically in every organ of the body, including things like, as you can see there, decreased sperm quality, so infertility potentially, dementia in older people, and also things like asthma development and clotting. A lot of the other gases are mainly associated with respiratory disease very clearly, and also a rise in hospital admissions for all different things, but that's kind of a blanket measure of effect. But nitrogen dioxide particularly is also linked to type 2 diabetes. So increased levels of nitrogen oxides in the air can give you an increased burden of disease in type 2 diabetes. But these are all very complex interactions. And a lot of these things, kind of as Emma explained before, the linking of these in a nice one-by-one pathway is not so simple, but generally the epidemiological evidence is showing a It's ever evolving and showing an increased level of effect on basically every organ in our body from any sort of air pollution at and below the WHO guidelines. I'll get more to that, but basically the effect is quite a lot, and that's why we care about this. So the mechanisms of action in terms of how air pollution does this, basically the air pollutants are inhaled, they are absorbed into your bloodstream, and then they can deposit. If they're very small, they can deposit, they can cross from the blood and then into organs and deposit there. And when they are there, they cause a reaction called, well, different reactions, but basically a reaction called oxidation, which is where you basically get this kind of stress response in your body and you get an imbalance in sort of the reactivity of different cells. It's probably a bit too much to try and go into in depth, but just to know there's oxidation. Also inflammation, so similar to when you might cut yourself and you get this kind of biochemical reaction that's trying to clear up anything that's lodged in there and fix the wound, you get that sort of reaction when you get air pollution depositing in anywhere in your body. And that leads to a whole lot of local effects that aren't very pleasant. You can also get dysfunction of your, say, blood vessels. So there you can see on the picture, endothelial dysfunction. So for example, air pollution can make your vessels, your blood vessels, become a bit tighter. And that can lead to higher blood pressure, for example. You can also get air pollution leading to clot formation. So, along the line of things that can happen to cause a stroke, air pollution can be something that tips the balance there in terms of how big a clot is and how big a clot forms to then cause a stroke symptom or a stroke scenario. You can also get effects on DNA and gene expression, such as it says there epigenomic turbulence, but basically they can affect your DNA, and it can also affect your hormone regulation. And there's a little picture there on the bottom right. So basically lots of different actions, but all mediated by this kind of absorption and the body's response to absorption of these air pollutants. So the public health effects of all of this are staggering. It's really quite terrifying when you look into it. So globally, the latest statistics are that 8.1 million deaths occur globally due to air pollution. And just for comparison here, as of the other day, the 15th of November, I looked up, there had been just over 7 million official COVID deaths since 2019. So the effect of air pollution every year outweighs all of COVID through official sampling. It's the second biggest cause of death globally, only beaten by high blood pressure. But currently, it is more deadly to global public health than smoking and also obesity. In Europe, Europe generally has quite good air quality. However, 96% of the EU's urban population is exposed to unsafe concentrations of PM2.5, and PM2.5 is particularly nasty. And it is the most significant environmental exposure in Europe. In terms of mortality, so deaths in the EU every year, over the WHO guideline, I'll come back to that. From PM2.5, the figure as of a few years ago was 238,000 people per year. From nitrogen dioxide, it's 49,000 people per year. And from, they're supposed to say O3, ozone, it's 24,000 people a year. These are a few years old, these figures now, but also there was figures in this modeling that showed an even greater number when you consider pollution under the WHO guidelines. So the WHO guidelines are based on the scientific consensus, as Emma touched on, but science is also establishing that there are effects underneath that guideline. But for all intents and purposes, we'll just stick to the WHO guidelines for now, but just to kind of reiterate, as Emma said, there is no safe level of air pollution exposure generally. So it's also worth mentioning there's interlinkages with climate change when we talk about air pollutants, because they often share a common source, such as combustion processes and industrial processes. They also do have an effect on the climate, and sometimes air pollutants are called short-lived climate forces because they do have an effect on climate, both locally and widespread. And there's also an interlinkage between the emission of air pollutants and increased temperature. So if we're getting increased average temperatures, we could get increased pollutants despite future kind of ambition and reductions in air pollution. So it's just something to notice there. There are often combined sources, but also, combined opportunities when we look at it to tackle both at once. We've touched on this, but the air quality guidelines from the WHO state that, for example, the average yearly exposure for PM 2.5 should only be 5 micrograms per meter cubed. There's others there. I won't go into many of them, but we'll just focus on PM 2.5. So it's there and it's 5. In the AAQD, the Ambient Air Quality Directive, we have a few changes, and Emma touched on many of these, so I won't labour the point, but we've got a change to the limit values for these pollutants. So this average pollutant per time period, we have changes to the allowable levels of that. We have the requirement for plans by member states. We have short-term emergency air pollution measures. We have other things such as super site monitoring, and that's also including monitoring of emerging pollutants. We have this clause or these provisions for a revision of the Ambient Air Quality Directive based on science, which is a little bit funny since, I'll get to that point in a second, but basically the Ambient Air Quality Directive isn't so much aligned with the science necessarily. And we've got the kind of access to justice and compensation clauses, which Emma touched on in much greater detail, so I won't go there. But basically, the AAQD 2024 limit is as shown. So if we just focus on PM 2.5 again, we have the WHO guidelines stating that 5 micrograms per meter cube should be the level. So 5 should be the cutoff. The previous EU limit was 25, and that's been brought down to 10. So as you can see, that's quite a reduction from 25 to 10. However, it's still double the WHO limit. And that's generally the trend across the different pollutants. They're not really, they've all been brought down much closer to what the science, the WHO guideline shows, but they haven't got all the way there. So it's interesting when you have these clauses around scientific revision when already the guideline doesn't really meet the scientific, let's say, safe level, even though no level is safe, but we're still not really even there. So it's a bit funny to consider that, but essentially the limit, the EU limit, is still higher than the WHO, what the WHO recommends. And here's kind of some maps to illustrate the burden of air pollution, and this I'm purposely included a little point here over Ireland to show these limits on different days. So this is November 15, this is last week, and this map here is about nitrogen dioxide. So the little pin I put there in that kind of dark orange just off Dublin Bay is 22 micrograms of nitrogen dioxide per meter cubed, and that is the cutoff there. So as you can see, a lot of places in Europe are much higher than that on this given day. So it is really quite a significant pollution, significant issue. And when we look at the different guidelines, you can see kind of just how much effect that would have. And here for the PM 2.5 levels, this is the same time. We can see that kind of very light blue color, maybe down just south, down near Carlo. We can see that's 5 micrograms. And you can see that everywhere that's lighter than that going towards orange is above that. So everything that's higher than that is above the WHO limit for PM 2.5 in Europe. But as you can kind of imagine as well, it's still allowable. Some of these figures are still allowable by the AAQD, the EU AAQD. So there's a bit of a gap there. But as you can see, like for example, Ireland is fairly good generally with air pollution, but a lot of Europe will stand to benefit quite greatly from this, to be honest. I've also included a snapshot here of just outside of Houston Station. There's an air pollution monitorer there. And I've included this one because it had an exceedance of nitrogen dioxide over 40 micrograms back in a few years ago. But as you can see, as of this snapshot, the average PM 2.5, let's focus on. Average PM 2.5 at the time was 15, and the WHO guideline is 5. AAQD is 10, but still, this is above that average. However, it needs to be a yearly average and over a longer time period. So this wouldn't necessarily be so much of an issue. And as you can see, the rating there is 2. So it's still kind of a safe level according to this monitor. But I just wanted to display that basically, even in Ireland with very clean air, we do still have an effect from air pollution, and we still have an effect, the above these levels that we would consider safe or legal, really, in the new directive. So it's just to point that out there. So basically, does the AEQD protect health? Yes and no. To reiterate again, there's no safe level of air pollution exposure. The AEQD does quite a lot to bring the allowable EU limits into something that's much more favourable for health, but still doesn't get to where the WHO recommends that and that authority should aim for. So we're going to see substantial, massive benefits, health benefits, and environmental benefits and infrastructure benefits and economic benefits and all of these sorts of things from this more ambitious level of pollution control in Europe with the AEQD. However, when we're looking at public health, we're not quite there, but we're making substantial strides. And Europe's air pollution story in the last 30 years or so has been very dramatic and very impressive. So yes and no, it's not all bad, but it's not perfect. Some positives, we have the greatly lowered limit values. We have the monitoring of new pollutants, which will also give us data on some more epidemiological effects and what we can do to better protect public health and environment. We have the access to justice and a review mechanism, but points for improvement are this scientific alignment with the WHO guidelines. We have this this ozone issue where ozone is a target value, not a limit value, which is kind of not enforceable in a way. So ozone could be put under a limit value, which would be much more legally enforceable. As Emma touched on, there's a few loopholes. So, balancing what is administratively possible with a higher level of ambition there would be great. And also this access to compensation really could be something that could be improved. But this is just looking at the health side. I'm not a legal expert nor an administrative expert, so we'll just keep it to public health. So in terms of where the future's going here, like this will really greatly benefit European air quality and European public health. And the impact studies when planning this revision were quite striking in terms of the positive impacts that can be achieved through this air pollution reduction. We're talking up to 0.5% GDP increase with air pollution control and cost benefit ratios of 6 to 12 times. From the highest level of investment, you can get back so much by controlling the air pollution effect on public health. This is one of the many EU policies under the European Green Deal, which look to move towards a zero pollution target by 2050. And this will greatly help that, but of course we still need to move into a future direction where we get pollution down even further. All of the countries in the EU need these strong policies in industry and transport, cities, agriculture, and energy to achieve all of this together, to achieve these zero pollution outcomes, but also these air pollution goals that we need to protect health. And generally, environmental rights and access to justice should be central to any sort of functioning, democratic, healthy Europe. So that's where we're going. Thanks for that. Hopefully that's an all right introduction to air pollution and public health and Europe. And I'm here if anyone has any questions, and I'll hand back over to Clodagh now.
Thanks so much, Cale. That was very complimentary to Emma's presentation and very interesting. So thank you for that. We do have one question for you, Cale, that came in as you were presenting. So someone has asked if there is any direct link between air pollution and risk of cancer.
Yes, there is. So many different types of cancers are increasingly being linked to air pollution, but lung cancer is very clearly associated to PM2.5 exposure, for example. But epidemiological evidence is always evolving, but there is quite a swath of evidence to link air pollution to quite a number of different cancers, but lung cancer is really one that is clearly associated.
Great, thanks, Cale. We have another question for you. This is from Mark Murphy, who asks, are we correct in saying that PM2.5 is the most health-harming air pollutant? And then secondly, would you have any advice on how best to communicate to the public that air pollution damages your heart health? Often the public only think about damage to lungs, understandably, and it can be difficult getting the message that your CVD system is most at risk from air pollution.
Yeah, that's a very difficult question. But to answer the first part, yes, generally PM2.5 is regarded as the most toxic part of the air pollutant mixture. And as we saw those figures I gave before, PM2.5 was up around 238,000, while the other pollutants in and of themselves were down in a few tens of thousands. So there's quite a lot of magnitudes of order bigger. In terms of communicating, it's really difficult. I think it's a consistent issue for a lot of people around the world. But I guess even just clearly stating these links, clearly it can be something really that people are coming to newly. It takes quite a lot for people to realize that maybe air pollution is present and that air pollution is also linked to health. So to kind of put these all it's quite a lot of prerequisites needed to then go and talk about, cardiac health, for example. I'm no expert on the communication part of it, but from some of the research I've seen, very visual representations of dirty air or dirty industries are quite a compelling image for people to be able to latch onto. So I know it'd have to be tailored to an audience. It'd have to be very built maybe with stakeholders and built with people involved, people who you want to target, but something that links science, links cardiovascular disease, has a strong visual representation, and particularly anything that kind of targets the health of kids. Those are all very motivating things in terms of communicating a message and having effective change in terms of air pollution from the research I've seen.
Great, thank you, Cale. Emma, there are two questions here for you that I'm going to put together, if that's okay. So someone has asked if there will be penalties for states who are not complying with the revised directive. And then there is a question from Paul. Will exceedances in the new directive be based on modelling or representative modelling?
Thank you so much for that. The point on penalties, so as in the previous directive, when the Commission gets wind of a member state which is failing to observe its obligations, there's a whole infringement procedure it can follow. And there are kind of several stages to that, but one final stage is if a member state is the subject of an infringement judgment and then doesn't take action accordingly, which in fact has already been the case for a couple of member states under the current directive, then a new infringement procedure can start for that failure to take action, which will result in penalties. So we haven't seen any such cases reach the penalty point yet under the current directive, but that remains a possibility in the new directive as in the previous one. In addition to which, and that's for penalties for member states, in addition to which, there is a kind of lengthened penalty provision in the new directive, which relates to member states laying down rules on penalties for, I think, the competent authorities which are failing to observe the obligation. So it says, member states shall lay down the rules on penalties applicable to infringement of national proceedings adopted pursuant to this directive. And so that's a question of the national organisation, the constitution, basically, of which authorities are responsible for compliance with the Ambient Air Quality Directive. So maybe you might have heard me mixing my words, sometimes referring to public authorities, sometimes competent authorities, sometimes local authorities. All the obligations in the new Ambient Air Quality Directive are directed towards member states, but then actually it will be a matter of kind of national constitution which authorities are responsible for compliance. And as I say, member states have an obligation to lay down rules about what competent authorities who don't kind of comply with their obligations under the AQD have to pay if they fail to do so. So it's a very long-winded answer of saying there were always rules for penalties on member states. Now member states also have to create rules for penalties for infringing competent authorities. Now, what was the second question? It was about modelling, if I'm not mistaken.
Yes, it was, will exceedances in the revised directive be based on modelling or representative monitoring?
That is a very good question. I'm just looking away because I've got the directive up in front of me. So in the first instance, they will be based on the data of the sampling points. So as far as I know, if the sampling point is recording an exceedance, that is where an exceedance will be will be recorded. That's where an exceedance has happened, is if it's recorded an exceedance. The importance of modelling and indicative measurements has been built on in this current directive. That much I do know, but I'd have to go back and have a proper detailed look at the directive to see what impact that then has on exceedances. As I say, my instinct is that it's the sampling, it's the actual collected data which leads to finding of an exceedance, but I would want to go back to check, so I can do that and then send an email afterwards if that would be helpful.
That's great. Thank you, Emma. There's a question about the contribution of aviation emissions to air pollution. I might put this to you both. So can you comment on the contribution of aviation to air pollution and the likely trajectory given expansion plans? So, and then what is positionary air pollution monitoring at Dublin Airport? This is kind of specific to Ireland, this question, so I will not put that question entirely to you, but can you comment on the contribution of aviation to air pollution generally?
I'll jump in. So from my understanding of the evidence, a lot of the effect that aviation combustion has is up above the level of where it matters for public health. However, there is some new evidence and analysis showing the effect in the area around the airport. Now, it's kind of not linked and associated so much through a really rigorous epidemiological study. However, I have seen some analysis from some NGOs that work on transport in the EU that there is really quite a significant burden of pollution and health effect related to ultrafine particles around airports. And I can imagine that, Dublin Airport is a very active and busy airport, so I can imagine there is an effect there. Without stating clearly and definitely that there is definitely a public health effect and it will go greater in the next few years, I would say logically there is an effect from the amount of that fuel combustion. But something that is good in terms of this, in terms of the AAQD, is this monitoring and greater attention to ultrafine particles. So that's PM 0.1. And that is kind of what we're seeing, what people are saying so far is maybe linked to the airport environment. So developing data in the next few years, logically from a public health point of view and a scientific air pollution point of view, I would say there is an effect and that expansion plans are bad from a health point of view.
Thank you, Cale. That's great. And then one question for Cale and then last question for both of you. So Cale, Thomas has asked if there is a connection between air quality and the development of autism. And for both of you, there is an upcoming election, a general election in Ireland in a couple of weeks. And politicians and political parties are canvassing at the moment. So if a politician or representative knocks on someone's door, what do they ask them in relation to air quality?
Great questions. Okay, so I'll come back to the second one. The first one again. So actually, let me think. It's tough. Okay, I'll go with the politician one first, maybe, and then we can circle back.
Sure.
So, like, something that was so great about the last general election was the inclusion of all that extra money for, say, the NTA to upgrade cycling and pedestrian movement and to prioritize active and public transport. So I think that was such a massive win, and maybe I don't know if maybe the results aren't so tangible yet, or maybe it's not generally known exactly how big a win that was, but this 30 times magnitude increase in funding for active and public transport was so important and does so much for air pollution, say in Dublin. So we're talking about a Dublin politician or something. I think building on those successes there would be just such an important thing, because along with that, we've also recently had the kind of traffic cutoff zone in Dublin. So those kind of things will really, really benefit health in Dublin. So we're looking for wins, and to building on those, I'd really focus on those personally. Leave it to you, Emma.
Yeah, something very similar. I guess the first question would be, the obvious one would be, what are you doing to protect my health from air pollution? And then maybe if you want to really double down, highlight that there's a new European law on air pollution which will need to be implemented. but it's not in line with the latest scientific recommendations. And in fact, compared to the rest of Europe, Ireland is in a much better position because of being kind of so far out west, and not the kind of air blows eastwards, and so you're getting less exposed to air pollution than, say, kind of Belgium or the Netherlands. So Ireland is in a really good position to take really ambitious action on air pollution and actually achieve air quality that is kind of compliant with the scientific consensus. So the top level question is, what are you doing to protect my air from air pollution, my health from air pollution? Kind of below that is, but in particular, what are you as an Irish politician doing to ensure that our air quality is better in the way that it can be than elsewhere in Europe and really complies with the scientific consensus?
Amazing. Thank you very much both. Cale, did you want to jump in there?
Yeah, I will. I'll just come back on the autism part as well.
Yeah.
And sorry for switching the order there. It was coming to my mind. So it's been suggested the link between air pollution and autism. I haven't seen any definitive proof. It would be remiss of me to state there is a positively proven link. It's definitely something being investigated. It's definitely something that is being proposed and strongly suggested by people. But I, in terms of effects, I've not seen it being kind of proven or something very motivating as yet.
Great, thank you very much. And thank you so much for everyone attending today and taking the time out of your day. And thank you so much to Emma and Cale for their expertise. The webinar, the recording of this webinar will be available on our YouTube channel online in a couple of weeks. And the slides will be accessible after this session as well, if anybody would like to find out more information. Thank you, everyone. Thanks. Bye.
Thank you.
Thanks.